Happy Sabbath. Sorry. Hey, welcome, everyone. How is everyone doing today? I am the host for this event this weekend. I'm AJ. If you need anything, please let me know. Let's cover a few things first and foremost. First of all, I'm going to pass the mic to Dr. Jim Bonson for a moment. He's going to make an announcement in Spanish.
Si hay alguien que necesita traducción, yo voy a estar traduciendo. Voy a sentarme en esta esquina. ¿Hay alguien? Ahorita no, pero si encuentran a alguien, avísenle que aquí estoy yo en la esquina.
Okay, there we go. I'm not sure exactly what he said, but something about if you want translation, you go sit over there or something like that, and they can translate for you. I think that's what it is. All right, so let's cover a few things first. Number one, most people need to know, where are the bathrooms? Well, the bathrooms are right out of these doors. Men's is on the left. Women's is on the right. If you go past the other set of doors, you've gone too far, okay? With that being said, we are delaying a little bit just because the lights at 1604 and Bandera were out. And so if there's a few people trying to still get here, we want to make sure that they are here on time. But we have a great evening. We're not going to keep you too late because we want you back here in the morning. So first and foremost, what I'd like to know, and I think I might know the answer already because I met a wonderful lady earlier, MJ. She and I are cousins, MJ, AJ, yes. And so this question, she might win. I would like to know who drove, not counting the people that flew in, but people who drove here tonight that live in the San Antonio area, who came the furthest? That's what I would like to know. Who came the furthest? MJ's coming from Canyon Lake. Anyone further than Canyon Lake? That's about a good 45 minutes or so. Hour. Stone Oak, well, we don't count traffic. We're counting actual miles. So Canyon Lake wins. Thank you. Very good. Let's go the opposite. I want to know who lives the closest. Anybody live less than a mile away? Do you live less than a mile away? Very, very close. Where do you live? How far away? 3 minutes. Very good. Okay. Very nice. Very nice. I live somewhere in the middle of Canyon Lake in 3 minutes. I'm in there somewhere. Well, we want to thank everyone for coming out tonight. And before we get started, I want to let you speak to a couple of people that you'll hear from later this week. But before I do that, I would like to know from a couple of hands, and my wonderful wife over here, my wonderful Vanna White, is going to run a mic to you so we can all hear. I would like to know why you came tonight. And before that, it's a two-part question. How did you hear about the conference? And number two, why you decided to come to the conference. I'd need just 3 volunteers, just 3, okay? And if not, then I'm going to call on some people because I'm a teacher by trade, and I just, have a hand right here. So I don't mind calling people out. Hello, yes, tell us your name, please, as well. Okay. Okay. All right. All right. You're a man who keeps his promises. Very good. Thank you very much. What type of doctor are you? Cardiologist. Okay, well, welcome. Okay, I need 2 more volunteers. 2 more. I'm going to go with people over the age of 20, though, for right now. I'll go to the younger group in a second, okay? All right, so let's give me 2 more volunteers. 2 more adult volunteers. The kids are very excited. Thank you for bringing them, by the way. And we have a wonderful kids program planned for tomorrow. All right, we have a hand over here. Mike is coming to you. All right. Your name, how did you hear about us, and why you decided to come? Welcome, Rosa. She's interested in health. Very good. How did she hear about us? Oh, very good. Her son, very good. I invited a few people from work. Not sure if they're going to come or not, but we'll see. All right, 1 more adult, then we'll get to a child, all right? 1 more adult. Come on, don't be shy. Don't be shy. I see some people I'm going to call on in a second. Oh, there we have a hand right here in the back. Here in the back with the beautiful baby. You take them. She takes the mic. You can steal the baby.
I also came because I'm interested in health, specifically preventative health.
Okay.
I think that's really cool and very needed. So thank you for putting this together. I really look forward to it. And I came,
How did you hear about us?
my friend attends this church.
Okay.
She shared a link to this conference, and I thought it was really cool, so I registered.
Very good. What was your name?
Francine,
Francine. Okay. And now we had a couple of kids that we're going to get to real fast. You had your hand raised. Did you have your hand raised? Yes. Well, tell me, what's your name? Oh, she doesn't. She changed her mind. Changed her mind. Okay. I think I had a hand back here. Yes. All right. Tell us. Yes. You shy now or no? Yes. Okay. Tell us your name and why you came.
My name is Noelle. I came because my dad is in charge of the security because my mom probably is doing something here. I have no idea. And because I might be interested in health.
All right. Maybe have a future doctor on our hands. Very good. Very good. Doctor, will you come up for a moment, please? And Dr. Ben, will you come up for a moment, please, as well? Thank you, Vanna. I appreciate it. Can I borrow that mic, please? Dr. Ben and I are old friends, but this is our first time meeting. I'm AJ.
Hi, AJ. I'm Brian.
Here's a mic for you.
Thank you.
Brian, you are one of our presenters for this weekend, correct?
That's right.
All right. And when are you presenting?
Tomorrow morning.
Tomorrow morning. Tomorrow morning. So if you look on the back, you have a guide, okay, that will tell you the schedule, and you will see what he's talking about and when he is presenting. I'm going to get back to you in a second, okay? Yeah. Dr. Ben and I are old friends. This is his third year here. We are grateful that he's here. Dr. Ben, when are you presenting? Tomorrow morning as well. So on the back, you'll be able to see. So I'm going to get out of the way for a moment, and I'm going to let these two gentlemen talk. And what I'd like them to talk about are a couple of things. You just got back from, oh, there's another doctor here as well. I'm sorry. Oh, don't. It's okay. We're going to get you too. Tell us your name.
Yes, my name is Vincent Estrada, and I get that promotion to either pastor or doctor all of the time.
Okay.
I'm a licensed professional counselor.
Licensed professional. When are you presenting?
Saturday afternoon on social emotional aspects.
Very good. So you'll find him on the back as well. And so what I'd like to do at this time is take a few moments, and I would like the doctors to tell us what they've been up to recently, okay? What's been going on in their lives and kind of some things. And I know you just have some cool things just happened that you just got affected. So we're going to hear about all of that as well. In fact, we'll start with you, actually.
Okay, well, I'm Brian Schwartz. I'm a cardiologist in Ohio, work at Kettering Health. And I think the cool thing you guys are referring to is once a year I go to Africa. I'm part of a ministry called Hearts for Mission International that is starting an open heart surgery and an interventional procedure program in the country of Malawi. It's just the second poorest country in Africa. And we go for 2 weeks at a time. We just got back having done 18 heart surgeries, about 7 or 8 pacemakers, and I was there doing some valvuloplasties.
How awesome is that? Malawi.
Malawi.
I've actually, until I get this one working for me, I've actually been to Africa too. Would you like to guess which country I've been to?
Kenya.
Not been to Kenya yet. This is my beautiful wife right here. And which of the two of us would you think is from Africa? It's okay. You don't have to answer that. It's her. My wife is actually from Africa, not me. She's from Zimbabwe, actually. He's been there too. Very good, very good. All right, Dr. Ben, you go right ahead. Testing. Okay.
I'm in physical medicine. I work with MedStar Health, one of the biggest hospital groups in the East Coast. And for me, what has been going on this past few years is being part of this community. And I'm so excited to be back here. But professionally, in recent time, I've been seeing a lot of geriatric populations. And that is why this particular conference, this preventative conference, especially this particular weekend, is so vital because I see all of us are going to get there by God's grace. Or is there anybody who don't want to age? But I know that we choices that they made is culminating in the kind of the health challenges that they have. So if anybody is here, it is so critical that we can actually nip some of the things right in the bud than trying to catch up later on. A lot of times, I've come to know that most of the challenges that we have, and it's more of like management. We are not actually curing as we think. People think we are. So, but if we can prevent, then this is the platform. Unfortunately, the insurance companies will not pay us for us to prevent because that's money out of their pocket. But I think that one of the best things, medicine was actually supposed to help us to prevent some of the things. It's not actually supposed to be curative. So it is so important. And this particular subject that we're talking about this weekend is one of the things that has gone under the radar without we even actually be catching up. And for me personally, getting to know about it and studying about it was like a holy grail to me. It was a aha moment for me. And I'm so excited to share the perspective and some of the things that I've experienced and the real life things that I've seen right on the ground. It's sobering whenever you have to experience that in real life and people talking about their struggles. Let me give it to that. Like just 2 days ago, I saw a patient that she had it all. Let me put it out. But she is now living by herself, having had to do a knee replacement. And she had to stick in her fridge about 2 months supply of food. And you can guess, since we've been talking about nutrition, you can just guess what kind of food she can get stuck in the fridge just to her. All because she has nobody to give her to actually do meal prep for her during the entire time that she has to go to rehab that she's back home. Just imagine that. And just imagine medication adherence. How is she going to just going around it, navigating at home. And for us, those of us who live in the East Coast, you know that the structures of our building is that all the bedrooms are up there.
Yeah.
And then there's nothing down, unlike here, which is so different. And sometimes I'm asking the architectural part, what is happening in the East Coast? But just imagine you having to be at home by yourself, having had a knee replacement or a hip replacement, and there's nobody to help you, even with taking a shower, eating, and all of that. That is why social connection is so important.
Yeah.
So that has been the life experience that I've had, and I think that this is why this is important. So whoever is watching us from anywhere, this is the place to be. If you are not here tonight, tomorrow, and this weekend, please be here. After that, we can go to the fiesta.
Hi, yes, my name is Nisim Estrada. I'm a licensed professional counselor, like I was mentioning. I'm coming from Arizona, so I really enjoyed seeing the overcast clouds. It's just sun like 362 days of the year, so just seeing clouds was really, really a treat for me. And I am the director of telehealth services for an intensive outpatient program out there in the state of Arizona. And some of the things I've been doing professionally is kind of trying to reach the patients that you were talking about, right? So the company that work has 8, 10 clinics, but we identified referrals that declined because they couldn't get to us, right? And so for a variety of reasons, people are not always to get the treatment that they need. Obviously, preventative is quite helpful. And what we do with the type of work we emphasize is we look at neuroplasticity, right? And this is just a fancy word that we can adapt, right? Wherever we are at this moment, this is not your destiny. You have the capacity to change. A lot of people try to overcome chronic pain, addictions, and they haven't been successful. And one of the things I'll be talking about is that missing ingredient of not just the medication, not just the counseling, but the social connections, and how that is oftentimes a missing ingredient for more successful treatment outcomes when it comes to these complex situations.
Thank you guys so very much. I'll take those microphones from you. We look forward to hearing all of this tomorrow. So if you are watching us online, please come tomorrow. If you are here sitting today, please come tomorrow and plan on coming on Sunday. Right before we begin, I'd like to invite our senior pastor, Pastor Vitaly Prolinsky, up to welcome you and to say a prayer for us.
Good evening, everyone. I think I had a chance to welcome most of you at the door or as we were handing things out. But once again, welcome to the Scenic Hills Seventh-day Church. We are happy to have this opportunity to spend this weekend together to learn some good information. Our slogan, "Your health thrives in community," is not just a slogan, it's a reality of who we are. As individuals, we're not just social, we are communal. So if you are a health professional or student of health or just somebody looking for hope, growth, development, I hope you find your place here, and it will be a wonderful opportunity for us not just to learn information, but actually create meaningful connections and relationships and to see how our life can become better. So because we're Christian, we would like to begin by thanking God and speaking with him. So bow your heads with me, please, as we pray. Thank you, Heavenly Father, for this opportunity for us to be together, to know you, and to grow together. I thank you for bringing people from near and far, and I pray that this night and this weekend will be a chance to grow, to connect, and to learn. Above all, may our lives be a testimony and praise to you. In Jesus' name we pray, amen.
Thank you so very much. And without further ado, I know you didn't come to hear all the other stuff that we just did, but we shared anyway. We are now ready for our first presentation and our second presentation by Dr. Prince Otchere. And so we'll welcome him, please.
Hello. Can you hear me? To the beginning. Well, thank you so much for the opportunity that we have to be here together to talk about health and to not just talk about medicine, not just talk about, procedures, but to talk about how we can live, in a healthy way. Can't hear too much. Okay. Can you hear me well? Okay, thank you so much. So thank you so much for being here again, and I would like to share these few moments with you to really kind of set a foundation for what we are going to talk about the rest of the week. The rest of the weekend. And I am excited because I've learned so much through these presentations, and I hope that you also get some information, not just for yourself, but for your kids, for your family, and for your patients, for those physicians here as well. Thank you so much for coming. I just started, at Methodist Hospital. I shared the information, and he said he was going to come, but I really wasn't sure he was going to come. But thank you so much for being here. So let's talk about the epidemiology, the epidemic of loneliness and social isolation. So let's start with this picture. And it's very funny because I heard AJ and some of the crew back there having a banter about something. So I was listening because I wanted to, because I had something similar to say. So let me ask you, who is healthier? Who's brave enough to answer? Who's healthier? I'm talking about the people, not you, but okay. Which of these people is healthier? B is healthier? Okay. Who else? 3? Oh, I thought it was, why is it 2, 3, and 4? Something happened, okay? So you need more information? Okay, I agree with you. We need more information because health is not just the physique. It is more than that. It is what is going into your body, nutrition. It is physical activity, exercise. Those two we really know a lot about. Well, not all the time, but at least we know a little bit more about that. The things that we don't think about or sometimes go in a back burner is mental health, social connection, purpose, and rest and recreation. Now, all these are important, But as physicians, we don't get training about this in medical school. We talk a little about nutrition, a little about exercise, not enough even of those, but the rest we really don't talk about it. Maybe some mental health as well. So if that is our training, how do you expect us to really help you? So that is why a lot of times you see your doctor and we are not saying all these things but this is an opportunity for us to learn about all these components. And today we are delving into one important component, which is social connection. And we are talking about it because it is a very important part of it. And social connection is a fundamental need. Just like we breathe, we need air, we extract oxygen from it, we get carbon dioxide out of it. Just like we need food, we need shelter. Social connection is a fundamental importance to us. Our ability to rely on one another is crucial to our well-being, and I'll go as well to say survival as well. Can you imagine in the past when our forefathers didn't have all the technology and they had to fend for themselves? Do you think those who were in isolation, they did well? They probably didn't. So that is an important thing. And so our brains, and you don't see very well, but all these are backed by data, and the data is over there. And I would be happy to share all the slides with anyone who asks. Our brains expect proximity to one another. Our brains expect proximity to one another. So the health and societal impact of isolation and loneliness is a critical public health issue that we have getting so much evidence that we now have to address. And nothing brought it to the front than COVID-19. COVID-19 came, the data was already showing that social decline was happening. The data was there, but the data is hidden in medical journals. But people were still meeting, people were still doing other things, and so it was not very clear that this was happening. And then COVID-19 hit, and what did we see, and what did the researchers see? People who were connected to each other, had strong social relationships, strong friendships, strong marriages, they thrived. People who were alone, people who were in dysfunctional relationships, even marriages, what did we see? There was a lot of anxiety, there was a lot of depression, there was a lot of divorce, not just because they now started thinking that they wanted divorce, but because they had not, there wasn't a healthy relationship already, and now they had time to be in the front of each other, and these unhealthy relationships now blossomed, and it caused a lot more problems. And that is why in 2023, the Surgeon General and all these public health professionals sat down and said, guys, we have an epidemic. Now, I studied epidemiology, and so I don't use the word epidemiology, epidemic like on a surface level. When we say something is epidemic, it means that it's not one, it is not two incidents, it is not a few people. It means that on a national scale, sometimes even on a global scale, this issue is alarming. And that is when you call something an epidemic. And it's so important that the Surgeon General decided that this is something that we need to get professionals on and issue a paper that everybody, physician, non-physician, can really read and understand, because we have something that is important that is not recognized. So let's talk about what exactly is social connection, because we are going to be using some of these words, and so it's important to understand exactly what it is. So social connection encompasses not just interaction, but relationships, the role people play in that relationship, and the sense of connection individuals and communities or societies may experience. Now, I'm going to make it a little easier. If you can see here, let's break it down. What everything I've said, you can forget about it. What exactly does it mean? What exactly are the components of this? Number one is that there's a structure. Number two, there's a function, and there's quality. What exactly is the function? Social connection involves the number of connections you have. It involves, are you by yourself, or you have only one person to relate to? Or do you have yourself, let's say maybe a spouse, maybe kids, maybe colleagues at work that you can actually connect with, or maybe your neighbors, you can actually connect with your neighbors. So that is the number. And then the second one, when it comes to structure, is the frequency of the interactions. So if you have a friend and you talk once a year, that's really not saying you are not friends, but that is not really social connection. So the structure is important. But then the function is even more important. What part do they play in your life? If you had there's a traffic light that is broken here. If you had an accident, and would you have somebody that you can call and you can reliably say that if they were not doing anything, they will just drop everything and come? Basically, what function does that person play in your life? If you were going through an issue, is this somebody that you can call? Because that's an important part of social connection. Not just the number of people, but what role are they playing in your life? And then the third one is the quality of it. The quality of the relationship. Now I'm going to use an extreme example. A gang can have the first two. Does it make sense? A gang can have the first two. They can have a strong connection. They talk to each other. They will call each other and come and help them right away. But what is the quality of that relationship? That's important. Let me bring it home. One of the basic social connections that we have is marriage. What is the quality of that marriage? Is it a safe place? Is it a toxic relationship where it is actually not helping you but actually causing problems? Or you belong to a social club, or you belong to some ethnic group, and for some reason, it is not having a positive impact in you. So when we talk about social connection, you need to look at all three of them. The structure, how frequent you are interacting. Number two, what role they are playing in your life. But exactly, number three, what is the quality of that relationship? Does that make sense now, what social connection is? Thumbs up? Good job. Okay. So now, everything we have said, if you don't have one or all three, you have social disconnection. You have social disconnection. And there are really two types of social disconnection. Two main ways we have social disconnection. Number one is we have social isolation, and we have loneliness. Now, a lot of times people ask me, what exactly is the difference? It's not the same. You don't want either of them, but they are not the same. And it's really important to differentiate them because each of them have different outcomes. So let's talk first about social isolation. So social isolation is basically objectively how having few social relationships, social roles, group memberships, and infrequent social interactions. So this one you can actually count. You can really quantify very well. Let me use an example. Let's say you were living alone and you really don't have access to other people. Basically, the number of people you encounter is limited. Number two, you move to a new country. Myself, I came here, I didn't know a lot of people. That is a barrier, and many of us can attest to that. During that time, there's a lot of stress. as new immigrants. Remote work and working from home long term. Just by the structure of it, you are limited in how many interactions that you have. So that's social, some ways you can have social isolation. Chronic illness or being in hospital for a long time, you are going to be alone. You are alone unless you are taking some steps for that. And then when you lose a spouse or a close companion, that is one number that you have missed. And so if you can agree with me, this goes to the structure of social connection. It talks more about the structure of social connection. Number two, now what this doesn't catch is the social roles and group memberships. Let me use an example. You come to a church like this. It's large. Sometimes you may be over there, and you are never really involved because of the general structure being there. Your role of maybe just being in and out can limit the quality of the interaction as well. They can limit how you interact, not just in the number of people you meet, but also in the quality. So it's not just the number, but in this case, the role you play. And a word I want to use is opportunity. Opportunity is the reverse. That group has to offer opportunity for people to also be involved, and that creates social connection as well. And so we talked about this. So loneliness. So loneliness is more on the subjective part. It is a feeling. It is what you are dealing with inside that is not easy to show. So let me read what is in the literature. A subjective distressing experience that results from perceived isolation or inadequate meaningful connections, where inadequate refers to discrepancy between what you expect, between what you expect or prefer and your actual experience. Let me use this example, a couple of examples. So you are in a crowd like us. When you are coming, you had expectation that you were going to meet some people, you're going to discuss, oh, what did you think about it? And let's say you left and maybe somebody talked to you, but your expectation was that you were going to have more people say hi to you. And so it leaves you like, ooh, I just didn't feel welcomed. I just didn't feel like I belong. So belonging is actually an important word here as well. The second one is surface level communication. Surface level communication. And this really happens in a place of low trust. When you are in a place where you are tense, people don't really want to, there's underlying block of trust is not there. You can talk about the weather, the birds, the wind, but nobody wants to dig deeper into how are you doing? How is your child? What is going on in your life? Because nobody really wants to do that. And this surface level communication can, if it happens for a long time, because when you meet somebody in the airport, you don't go into that detail, right? But if you are in a place, let's say a prayer group, and everybody's having unanswered, unspoken prayer, and everybody's like going over the surface, and in a long time, you just don't feel that connection. Or at work, nobody's talking about their kids. They are talking about, this Paul's great. But when it comes to like intimate stuff, nobody really shares surface level, and that leaves people not feeling that I'm connected to this as well. Social media can also cause loneliness as well. When you see everybody doing everything out there, and you just don't feel like you have that opportunity, because there's one thing you will have. It's basically you against the world, and everybody's posting the best part of their life, and for some reason, all of your life doesn't measure to the best part of the lives people are And so that can create a level of loneliness as well. And is it true or not? That's not the issue, but that is what you are feeling at that point. The next one is emotional disconnection in marriages or relationships. So physically together, emotionally distant. It's not just marriages. It's any relationship where, a lot of times trust has been broken and people can't really be themselves. They just have to be there. They are there for the paycheck. That's an example for work where things are like not right. They are there, but they are not really there. In a marriage as well, and in other environments as well, this can be an issue. And then being misunderstood or unable to express yourself, that is painful. You have ideas, but really, you're like, hey, maybe this idea, we should do it that way. And, oh, okay. And then people move on. How do you feel when that happens? You feel like apart from being disrespected, it just feels like you are not needed. You are not, and so it gives you feel that even though they are people, you may not feel that you belong. You are become lonely as well. And so these are some things that we want to think about. So what are those are the definitions. So what are the current trends? So a 2022 study showed that only 39% of adults in the U.S. said that they felt very connected to others. 39%. Less than half of all Americans who were surveyed said they feel belong. So the other half are telling us that they don't feel belong. And that's a big number. And half of U.S. adults report experiencing loneliness, with some of the highest rates among young adults. And so that's important that we kind of pause and ask the young people, how are you doing? Like friendship, and we will get to that as well. It's maybe a little too small, but basically, this is basically a meta-analysis looking at several things. One is social isolation, how it's increased over time. Most of this was measured in time. Household family engagements decreased several hours per month. Companionship has decreased 14 hours per month. Just doing stuff that we just enjoy. We just like fishing. Let's go fishing. Those things are decreasing over time. Social engagement with friends are decreasing. Non-household engagements. And basically, across board, people are not engaging and they are not connected to each other. Trust, which is really one of the fundamentals or the foundations of both of what we talked about, to have that connection. In a poll in 1972, 45% of Americans felt they could reliably trust others. When that was repeated in 2016, only 30% said they could trust others. And looking at how society has become so polarized along political lines from that time, I wonder if they did a study in 2025, what that would be. Based upon all the other trends, I can extrapolate that it will be even lower than that. So we know that the trends are not good, but why care? Why care? Because of these things. Because we know that loneliness and social isolation increases the risk for premature death by 26% and 29% respectively. In this study, 26% goes for loneliness, and then the 29% was for social isolation. Now, the difference is not much, but it's a big number. It's a big number that we can say that if we don't have this, our lifespan is really shortened. And this was in the Surgeon General's report. Basically, lacking social connection is as dangerous as smoking up to 15 cigarettes a day. Let that sink in. Lacking social connection is as dangerous as smoking 15 cigarettes a day. That's not cool. Well, it doesn't mean that you are smoking because you are lacking social, but the effect is what we are talking about. So I hope that it creates in your mind how bad it is when we are not socially connected. Cardiovascular. Among all, I'm a cardiologist, we have a cardiologist, we have another cardiologist. Interestingly, among all the health outcomes, the most effect was on the cardiovascular system. On the cardiovascular, so the heart, but also the other organs. And here, they found out that in 29% of patients, 29% increase in heart disease risk when patients had loneliness. And also a 32% risk of stroke when patients had loneliness. These are not small numbers. And so these are important reasons why we have to talk about it. And this paper just came in last week. This paper came last week. And basically, this paper looked at social disconnection and heart valve disease. And what they found was that in this study, loneliness, but not social isolation. Remember, we talked about both loneliness and social isolation, but loneliness predicted having your heart disease becoming very degenerated or becoming very calcified to the point where you may get to a point where your heart valve cannot open. And this is actually very important because we only talk about cholesterol, we talk about hypertension, but we really rarely talk about this. But this is the end result of loneliness as well. Hypertension. This study did when people have social support, they found out that 36%, there's a 30% lower risk of high blood pressure, those who had support. Your blood pressure reduced. And so if you have hypertension, this is actually an important thing. Being in healthy social circles is an important thing that we can be in to lower our risk. And other health outcomes, now we can't talk about everything else, but other health outcomes. Diabetes, also there is an increased risk when you have social disconnection. There are infections as well. People that have social disconnection, they get infection easily. And we also realize that they also usually have a weak immune system, which now also causes more infections as well. And so these are all health effects that we see as well. Brain health. Chronic loneliness and social isolation increases the risk of developing dementia by 50% in adults. Like 50%. And so that's a big number. So that's an important reason why we need to talk about it. And mental health. And this one is really like a cycle. It's like two things. It's like a chicken and egg thing. So people with depression and anxiety, they tend to have social isolation and loneliness. And also, having social isolation and loneliness can lead us into depression and anxiety. And if nobody breaks a cycle, then it's basically we have a cycle that feeds on itself. Now we are depressed, and now we don't want to talk to anybody. Now we don't want to talk to anybody, and now we are getting more depressed. And so this is a place where we want to intervene. Somebody needs to step in to help us with this. So social connection influences health through multiple pathways. So we're going to just quickly talk about some of them. So one important way is the biology. And a very important one is the stress hormones. So when we have social disconnection, our stress hormones start increasing, cortisol and all the other stress hormones increase just by being by themselves. If we measure, and several studies have measured that increases as well. And so, and it does also affects our gene expression, the way that the genes are expressed as well. The second one is psychology. And here we say globally, adults rate their social relationship with family and close friends as the most important source of meaning, purpose, and motivation in their lives. And so when this is not there, we are low on hopefulness, low on resilience. We don't feel safe as well, and all those go back to number one, increases stress and increases inflammation in our bodies as well. And also, social connection provides increased opportunity for support, that's reducing the likelihood of perceiving challenges, situation as stressful, because if we think it's very stressful and it's chronic, we have chronic inflammation, and that doesn't help as well. Behavior. So people are far more likely to be physically active if their peers exercise. So when we are connected with people, and remember we talked about the quality of the relationship is important in social connection. When the quality is good, it affects behavior as well. Physical activity, which Dr. Ben is going to talk about. Nutrition, which Dr. Brian Schwartz is going to talk about. Sleep, smoking treatment, and the way we process, and we will also hear about that. So everything is really in a cycle. So this is the end of this presentation. We are going to take like a 5 minutes break. I hope everyone has one of these, and as a group we will kind of talk about it. If you happen to have your kids, spouse close by, you can sit by them and maybe chit-chat a little bit whilst we are taking a break. But if you also want to sit close somebody, or if you want to just reflect, you take one home and talk with your kids and your family about it. You can do that by yourself as well. But you are encouraged to do what is you feel comfortable with. Thank you so much. Yes, go ahead. Yes, go ahead.
Thank you so much for that talk. Very, very informative. I'm curious, as a physician, how you screen for loneliness or social isolation. And if you do notice that in your patients, what are the tools that we have to help end that cycle?
Very good. And I think that's a very good question. And I have all the others. My next slides is going to go over that. So very good question. It's very important, but it's in the next slide, so I'm going to save it for that.
Oh, thank you.
Yes.
Okay, at this time, we'll just take a quick 5-minute break. You can work on the sheet if you want, but just kind of wake up for a second, and then we'll do another 20-minute session, and we'll get you on out of here.
Okay. Was the volume going down? Hello?
It's good. It'll look like that. It should be better now. It should be better now.
I need them to turn it off.
por si casi acaba de llegar la traducción al español también. Aquí estoy sentado en la esquina. ¿Hay alguien que necesita traducción? Nobody needs a translation in Spanish.
Okay, just checking to make sure, in case somebody slipped in. All right, without further ado, we're ready for part 2.
Can I add that to it as well, just in case my mic slips off? Okay.
Let's turn it off for now.
Yeah, hello.
You want to turn it back on?
Yes.
Because I get feedback via both.
Oh, okay. Okay.
So you can turn it off right now.
Okay.
Here.
Thank you so much for staying. And so this session is going to be shorter. It's going to be interactive, and hopefully it will be helpful for all of us to be able to address this important issue. So moving towards social connection. We are moving away from disconnection at this point. So who really should be involved in going from social disconnection to social connection? It should be everybody. It should be everybody. It should be families, it should be schools, it should be workplace, it should be the government level, because it's government level because look at what we have. I cited a lot of information from the guidelines. It should be healthcare providers, it should be community organizations, faith communities like us. We all have a part that we can play. Okay? So the first few I will go through quickly, and then we'll get to this and we can talk about it. So, like I said, we are going to not talk about national level and state level too much. We're going to deal with the rest of these. So, as schools, what can schools do? Schools can develop a strategic plan for school connectedness and social skills with benchmark training. Schools can build social connection into their health curricula, implement socially based education techniques, and create supportive environments as well. And now I didn't go into the details, but there are very innovative ways that schools can do that. For example, if you have a STEAM fair, and one of your questions is, well, how can students, help create an environment of connection? Now they can come up with so many brilliant ideas that is moving from social disconnection to social connection and community. So students, you can think about ways where you can also help as well. Workplace. So at the workplace is an important place because we spend so much of our time here. Now, as good as remote work is, it has its disadvantages as well, and we have to recognize that as well. So make social connection a strategic priority in the workplace at all levels. Work parties and work lunches and all those things are very important, and that away from everything else that is like the numbers and the actual work are important. Creating practices and workplace culture that allows for people to connect at one another as whole people. And this is the way that the quality of the interactions creates a culture that makes people want to connect as well. See, my partner is here, and I told him not too long ago, would I want to go to him if I need something? I think he can help me, probably, right? So those are all important things that we can do. So put in place policies that protect workers' ability to nurture their relationships outside of their work. If they basically want you to be at work the whole time and they are basically not helping you to connect, it's going to drain you and it's going to cause issues as well. So consider the opportunities and challenges posed by flexible work hours and arrangements as well. They are helpful, but at some point you need to go in and connect with your colleagues and things like that. Hi. So community-based organizations like ourselves, like a mosque, like a temple, like all the other places, social connections can thrive there. So advanced public education, and that is what we are doing here, create opportunities and space for inclusive social connection, and that is what I mentioned. You have to be intentional to create that opportunity. And so I could say that, maybe strategically we are a large church, so we're going to be intentional in forming smaller groups and do that and do that. That way we have smaller units. You want to create opportunity, you want to create space, you want to encourage it. That way everyone feels that they belong, because belonging is an important part of the equation as well. and foster a culture of connection in the broader community by highlighting examples of healthy social connections and also leading by examples. So we are going to take this. If you are not a parent or caregiver, you can still do it because you probably are a mentor. You probably have somebody who looks up to you. And so think about that and see how you can foster that. You may be a teacher, you may be, we are caregivers in some way. So let's look at that. You have that, and I want us to follow along and feel, I want to do mine too. And so I'll see how my wife and we match on those skills. So I want us to all do it together. So let's do it together. And at the end of it, I want 1 or 2 people, this is purely voluntary, to say, this is an area where I think I'm strong. This is an area where I think I can improve on. This is just voluntary. I'm not going to call anybody because, we want everybody to feel comfortable. So, so invest in your relationship with your child or loved one by recognizing that strong, secure attachments are protective and foundational. We're investing in your relation with your child. How do you think you are doing? So let's answer that. How are we modeling healthy social connections, including constructive conflict resolution, spending time together, and maintaining relationships with the family, friends, and neighbors? So how are we doing that? Or how are you doing that? And so you can have yours, your 5 is good or 5 is bad? Sorry. 1 is low, 5 is best. Not at all, somewhat, and then 3 is in the middle, 4 is, I think is good, 5 is like great. So it's on the scale of, it's low to high. 1 is lower than 5. So let's that. Okay. And then number 3, help children and adolescents develop strong, safe, and stable relationship with supportive adults as grandparents, teachers, coaches, counselors, and their mentors. How are you doing that in your environment? With your, let's say, your kids or your mentors? Are you actively working on something like that? So let's move on. How are you encouraging healthy social connection with peers through friendships and participation in structured activities like sports and community programs, or through playing with the neighbors and all that? How are you intentional in doing that? Being attentive to how young people spend their time online, delaying social media use, and prioritizing in-person connection building. How do you think you've done so far? And this is going to be your starting point to where you want to get to. Identifying and reduce behaviors and experiences that increase risk of social disconnection, including bullying, excessive or harmful social media use. So, are you actively trying to look for these things that may be causing dysfunction, or you haven't paid attention to it, and this is an area where you think you can improve? And talk to your children regularly about social connection to understand loneliness and isolation, reduce stigma, and create space for sharing, because the kids may be experiencing this without being able to put a name to it. So being able to talk to them about what loneliness means, what isolation is. Number 1 reason why people commit suicide is because of isolation and loneliness. And what happens is that after there's loneliness or a lot of parents are not even aware that their kids felt lonely or something. Sometimes it's through their written notes that they left behind. And so how are you actively screening with your kids? How do you feel that you are doing with this? Looking out for warning signs of loneliness and social isolation, such as increased time alone, excessive time online, limited interaction with your friends. Hey, why are you not playing with your friends? No, I just want to be by myself. It's okay to retrieve some time to spend quality time by yourself. But is this becoming a pattern where you see that your kids are just online, they are just in their room, and they are really not actively engaging and having fun with other kids? And then are they connect you to helpers like counselors? And this may not apply to everyone, but how are you doing when you see that as well? So this is for parents and caregivers or mentors. And this is purely voluntary. If somebody wants to share just a reflection of looking at this, where they think they are doing great, where they think they could do better, and anything, you can share. AJ or somebody with a mic can, share with us. That way we can see what other people think. Anybody wants to?
Do you have any volunteers that would like to share how they think they're doing on the first sheet there? No takers? No takers?
We won't call on anybody, so if there's no tickets, that's good.
Okay.
That's okay.
Everybody's shy today, sir.
That's okay.
They're afraid that you're going to
There's
give
a
a
lot of
grade out.
reflections.
Yes.
Now,
If you were to offer $100 right now, you might have some volunteers.
That's okay. So that's okay, but please take it home, spend some time with your kids or your spouse or your kids and see how you can improve that if you saw areas you need to improve. So let's go to the next one, which is all of us, each individual. Okay. Again, 1 being the least and 5 being, the best. Understanding the power of social connection. How are you understanding the power of social connection and the consequence of social disconnection by learning how structure, function, and quality impact relationships, health, and well-being? What was your understanding before coming in here? What was your understanding? You can rate it, 1 to 5, and that should be a starting point for you to delve into with your spouse, with yourself, because you don't want to do social connection assessment and improvement by yourself as well. You want to do it by yourself, but also in connection with other people as well. But what was your understanding of the function, which is the number, the structure, the function, and quality as well? Investing time in nurturing your relationships through consistent, frequent, and high-quality engagements. Take time each day to reach out to a friend or family member. How do you think you are doing when it comes to something like that? And trying to build, the structure and also, the quality of it as well. How are you doing when it comes to minimizing distractions during conversations to increase the quality time you are spending? For example, avoiding checking your phone during meals, important conversation, and family time. How are you doing with that? I would tell you mine. Mine is not good. And that's something that I would definitely want to improve on. Seek opportunity to serve and support others, including family, co-workers, friends, mentors, or your community. Forming community is not a one-way streak. It's not always going to come to you. Sometimes you need to, go out and do things. So how are you in seeking opportunity to serve others, including your family, your co-workers, friends, or members, seeking for ways to be helpful? Sounds like something that Jesus would do, right? Yeah. And then let's talk about be responsive, supportive, and practice gratitude, strengthening relationships and social bonds. When somebody does something for you, do you show gratitude? Because guess what? When you show gratitude and you show respectful, the people are more likely to come back. How intentional are you in expressing gratitude when somebody does something for you? Actively engage with people from different backgrounds and experiences to expand understanding and relationships. So someone who is maybe in a wheelchair, someone who is younger than you, someone with a different ethnic background. How do you think you are doing? Because that expands the quality of your relationships as well. Participating in social and community groups, fitness groups, religious groups, hobbies, professional services. How are you doing that? How are you doing with reducing practices that lead to disconnection, including excessive social media use, unhealthy relationships, and too much screen time in general? How are you doing with that? And seeking help during times of loneliness or social of isolation by reaching out to family, friends, counselors. Do you seek support? And this I think I was talking to my wife and like Ben. Sometimes this can be very cultural. Like, in my culture, in men, you don't like to seek help. It's not very macho. It's not very masculine. And so like, oh, maybe you should seek help outside here with friends. And it's like, I don't want to share my stuff. Of course, everything should be built on trust. But do you actively seek help when you need to build community outside of your home as well? Open with your healthcare providers about signal life changes to and basically being able to share with them as well. How are we doing that? Okay, and the last one is making time for civic engagement as well. And so this is something that you can do by yourself. And I'm going to mention for physicians, I didn't put it here, but physicians, number one, the things that we can do is, number one, is that we need to recognize risk factors in people that we are seeing. The older we get and we have spouses that are not with them, widowhood can be one risk factor for loneliness and social isolation. People of different sexual orientation tend to feel very lonely as well, and so we can be empathetic and also talk to people like that. People with chronic illnesses, people going through cancer treatment, people with mental health issues, depression, and so these are risk factors. However, it's not limited to this. So there are tools like tools that we can use. UCLA 3. It's like a assessment tool that can be used. One is called Alone. It's also an assessment tool that we can use as well. But just basically asking these three things: structure, function, and structure, function, and the third one as well. Who can help me? The quality of this. So, how many people? What is the? Are you single? Are you? How many do you have neighbors that you talk to, and all those that can be helpful. And then we can talk about the quality of talking about if you needed help right now, who would you call? Do you have somebody that you call? Number 3 would be, how do you feel in your relationship? Do you feel safe in your relationship? How's your, all those. So those are very important. But they are Alone and other screening tools that can be used as well. So this one, anybody wants to share their reflection on maybe one area that they think they are doing well, or just one area that they think they need improvement on, and to create somebody raise their hand.
Did you raise your hand? No. Pass me mine. Pass me mine.
Nobody wants to. Okay, go ahead.
Oh, we have
Thank
a
you
volunteer.
so much.
There we go. Yes, there we go.
My weakness, of course, is media. Because I'm a widow, so with that, sometimes when you're at home alone, that's what you have. But I try to force myself to connect, and that has been something I have to put in my mind to forcibly connect. But it's easier when I go out. The first time I did it, it was overwhelming. But after that, it's gotten easier.
Thank you so much for sharing.
Like to talk.
Thank you so much for
Thank
sharing
you.
with us.
Thank you. Anyone else brave enough to share?
I think there's somewhere who's brave. Yes, there's.
Yes, here we go.
Okay, we're new to Texas. So, and then my husband got sick. And then someone said you should do the walk with the doc. So we go walk with the doc. The doc starts talking about being ill and how important it is to have social connections. So we go to game night, and he's trying to help the kids learn how to play ping pong. And we go to meetings like this to meet new people. And we are almost happy we're here. We haven't found people to help us yet, but we're getting there.
Thank you so much for Where do you mind if I ask what state did you move from?
Okay, we're Army brats.
Okay.
So we started out in New York, and then the next place was New Jersey, the next place was Maryland, and Texas.
Thank you so much for sharing with us. I would take one more if somebody else wants to share with us.
All right, I
think
see a
there's
hand.
one more here.
I'm coming.
Okay.
Okay, mine is the very last one, civic engagement. We've been hearing that our water bill and our electric bill is going to go up, and they always say that we're going to have a town hall or a speaking where you can talk about your the situation, and that's something I'm going to start doing because I don't want to pay more. Number one, and then also I think it'll help me to come out of my shell.
Thank you so much for sharing. I think I saw a child raise their hand, and I would love to hear that.
Do we see another hand somewhere?
Did you want to say something? Okay.
Oh, no?
Well, thank you so much for being here. Thank you so much for going on this adventure with us. I think this is a very important topic. I have learned a lot myself, things that I can practically, work on with my family. I hope that you have learned something. Come tomorrow, we will have several speakers who will delve into specific areas of social connection, and I'm really hopeful that you'll be blessed by coming today. Thank you. AJ, over to you.
All right, again, thank you so very much. I hope that you got something out of tonight. We have much more planned for you tomorrow. Please tell your friends and tell your neighbors, tell even the people you don't like. That helps with the social connection as well. To come on out tomorrow. We have a full day as well planned for tomorrow. We also have a full day for Sunday. Well, not full day, but a partial day for Sunday. So we have a full weekend. And the best part of all of it is that there's two parts that are great. Is one, that it's free, right? So there's no charge. Two, there's free lunch tomorrow as well. There's like a healthy lunch thing going on tomorrow here, so please come for that. And number three, I forgot the third thing that it was. Connection, yes. The whole thing we're talking about tonight, the whole social connection. You can meet some new people. So as we close tonight, before you leave, don't just run to your car, because I know that's what we like to do. It's like, oh, it's over with, let's leave. How about let's make a challenge to ourselves to meet one new person before we go to our cars, okay? Just one. I'm not asking you to meet 5, but somebody that you haven't seen before, just one person, and just introduce yourself. Don't just say, hey, I'm AJ, and ask them your name. Just try to find out where you're coming from and how long you've been in San Antonio and all those things. Do you have a dog? Do you have a cat? Do you have a monkey? What do you have, in Texas, by the way, just as we're about to end, I promise you, do you know there's more tigers in Texas than like in any other place in the country? It's crazy. Anyway, look it up. Google it. It's cool. Anyways, so as we close, we just want to close with prayer, and then I'm going to let you kind of just mingle for a moment, all right? Let's bow our heads. We thank you, dear Lord, for the information that we received tonight. We pray that it's not just head knowledge, dear Lord, but that we would be able to put in practice the things that we've heard and we've learned. We ask for safe traveling mercies home and for you to bring us safely back tomorrow. In your name we pray, amen. Thank you again for coming out.